What if the blood pressure number you were told is normal is actually putting your health at risk? And what if the number that made you worry, the one that sent you searching for answers, is not necessarily dangerous for your age? It sounds confusing, but this is exactly where many people over 60 become lost. They look at one number on a blood pressure monitor and try to decide whether they are safe or in danger. The problem is that blood pressure is not that simple. After more than 2 decades of treating adults over 60, one thing becomes clear. The biggest danger is not only high blood pressure itself. The bigger problem is misunderstanding what your numbers actually mean. Millions of older adults walk around unsure whether their readings are too high, too low, or completely normal. Some people are told their blood pressure is fine, while another doctor tells them they need medication. Some patients take too much medication and feel dizzy, weak, or unstable. Others do not get enough treatment and remain at risk for serious problems without knowing it. The confusion is understandable because blood pressure recommendations have changed over time. Numbers considered acceptable years ago are now viewed differently. At the same time, many people measure their blood pressure incorrectly at home and make decisions based on inaccurate readings. Today, we are going to clear up that confusion. You will learn what blood pressure numbers really mean after 60, why the top and bottom numbers are not equally important, how to identify dangerous patterns, and how a simple calculation called pulse pressure can reveal information that many people never hear about. Before understanding what numbers matter, you first need to understand what blood pressure actually measures. Your blood pressure reading has 2 numbers. The top number is called systolic pressure. This measures the force of blood pushing against your artery walls when your heart contracts and pumps blood through your body. Imagine a wave hitting a seawall. Every heartbeat creates that pressure wave moving through your arteries. The bottom number is called diastolic pressure. This measures the pressure inside your arteries when your heart relaxes between beats. Think of it as the water level between waves. It represents the background pressure your blood vessels experience every moment. Both numbers matter, but after 60, they do not always tell the same story. As people age, arteries naturally become less flexible. Young, healthy arteries can expand and absorb the pressure created by each heartbeat. Older arteries often become stiffer and lose some of that ability. When arteries become stiff, the heart's pumping force creates a stronger impact against the artery walls. That is why the top number, systolic pressure, often rises with age. This does not always mean something is immediately wrong. Sometimes it reflects normal changes in blood vessel structure. But when the pressure remains high for years, it can increase stress on important organs. The bottom number can behave differently. As arteries become stiffer, they may not return to their original shape as effectively between heartbeats. Because of this, diastolic pressure may stay the same or even decrease in some older adults. This creates a pattern called isolated systolic hypertension. The top number is elevated, while the bottom number remains normal or lower. This is one of the most common blood pressure patterns seen in adults over 60. For many years, people followed an old idea that blood pressure naturally increases with age, and that a higher number was acceptable simply because someone was older. That belief caused problems. Research has shown that consistently high systolic pressure in older adults can increase the risk of stroke, heart problems, kidney damage, and changes in thinking ability. But the opposite mistake can happen too. Treating every slightly elevated number aggressively without considering the whole person can also create problems. Older adults are not all the same. A healthy 65-year-old who exercises regularly may have different needs compared with an 85-year-old who has balance issues or a history of falls. This is why there is no single blood pressure number that is perfect for everyone. Your age, health conditions, medications, activity level, and personal risk factors all matter. The goal is not to chase the lowest possible number. The goal is to find the number that protects your health without creating new problems. And this is where modern research changed how doctors think about blood pressure treatment. One major study called the SPRINT trial looked at thousands of adults and changed many conversations about blood pressure control. The study found that lowering systolic pressure could reduce certain cardiovascular risks in some older adults. But there was an important warning. More aggressive treatment also increased some risks, including dizziness, kidney problems, electrolyte changes, and falls. For older adults, a fall caused by medication that lowers blood pressure too much can become a serious health event. So the real question is not simply, is my blood pressure high, The better question is my blood pressure too high for my body, my health, and my situation? To answer that, you need to understand the numbers, the hidden risks, and how to measure them correctly. Because the number on your monitor is only useful when you know how to read it. So what blood pressure numbers should you actually pay attention to after 60? This is where many people want a simple answer. They want one number that tells them everything. But the human body, in its usual refusal to be convenient, does not work like a simple calculator. Blood pressure targets depend on your age, health, and risk factors. For many adults between 60 and 75, a resting systolic pressure below 130 is often considered a strong target if it can be achieved safely. A reading between 130 and 139 may be acceptable for some people, especially when they feel well and have no concerning symptoms. Numbers between 140 and 149 usually deserve attention, monitoring, and lifestyle changes. Consistent readings around 150 or higher generally require action and discussion with a healthcare professional. For adults over 75, the target may be different because preventing falls, dizziness, and medication side effects becomes even more important. A number that looks good on paper is not helpful if it causes you to feel weak, unstable, or unable to move safely. The bottom number, diastolic pressure, also matters. A consistently high diastolic pressure, especially above 90, can place extra stress on blood vessels and organs. But there is another side that many people overlook. A bottom number that becomes too low can also create problems. In older adults, very low diastolic pressure may reduce the amount of blood reaching the heart muscle between beats. This is why looking only at the top number can create a false sense of security. Imagine someone has a reading of 128 over 52. Many people would only notice the top number and think everything looks perfect. But the gap between those two numbers tells another story. That gap has a name. It is called pulse pressure. Pulse pressure is calculated by subtracting the bottom number from the top number. For example, a blood pressure reading of 150 over 70 gives you a pulse pressure of 80. A reading of 130 over 80 gives you a pulse pressure of 50. Why does this matter? Because pulse pressure gives clues about artery stiffness. When arteries become less flexible, the top number often rises, while the bottom number may fall. This creates a wider gap. A wider gap may indicate that the blood vessels are losing some of their ability to absorb the pressure wave created by each heartbeat. For older adults, this information can be useful because artery stiffness becomes more common with age. A pulse pressure below 40 is generally considered lower. A range around 40 to 60 may be acceptable depending on the situation. A pulse pressure above 60 may be a reason to discuss cardiovascular risk with your doctor. For example, someone with a blood pressure of 160 over 70 has a pulse pressure of 90. Most people focus only on the 160, but the large difference between the two numbers gives additional information about how the arteries are behaving. This does not mean pulse pressure alone diagnoses a problem. It is another piece of information. Blood pressure is like looking at a complete picture instead of focusing on one small part. Another important issue is low diastolic pressure. Some older adults become dizzy when standing, feel weak, or experience repeated falls because their blood pressure treatment has lowered their pressure too much. One example is an older patient who had a controlled top number, but a very low bottom number. The person felt dizzy every time they stood up and had already fallen several times. After carefully adjusting treatment with medical guidance, the symptoms improved while blood pressure remained controlled. The lesson is simple. The goal is not the lowest possible blood pressure. The goal is the right blood pressure for your body. Before worrying about your numbers, there is another major problem that affects millions of people. They are making decisions based on incorrect measurements. A blood pressure reading is only useful when it is taken correctly. Many people unknowingly create false high readings at home or in a doctor's office, and those mistakes can completely change how your health is managed. One of the biggest mistakes people make is checking blood pressure too quickly. Imagine walking into a clinic, after parking your car, walking through the building, sitting down, and having your blood pressure checked within a minute. That number may not represent your true resting blood pressure. Your body has not had time to calm down. Your heart may still be working harder from walking. Your stress hormones may still be elevated. A proper blood pressure measurement begins with rest. Sit quietly for about 5 minutes before checking. Keep your feet flat on the floor. Support your back. Keep your arm resting at heart level. Do not talk. Do not scroll through your phone. Do not watch television. Small details matter. Talking during a blood pressure reading can increase the result because your body is responding while the measurement is being taken. Even a simple conversation can change the number. Another common mistake is crossing your legs. It seems harmless, but body position affects blood flow and pressure. Your posture during the test should be relaxed and consistent. The cuff size also matters. A cuff that is too small can create a falsely high reading. Many people never think about whether the cuff actually fits their arm correctly. Using the wrong cuff can make a normal reading appear abnormal. Another issue is measuring only one time. Blood pressure naturally changes throughout the day. Stress, pain, caffeine, activity, and emotions can all temporarily increase it. One high reading does not always mean you have a long-term problem. A pattern tells you much more. This is why home monitoring can be valuable when done correctly. A good routine is simple. Measure your blood pressure after waking up, before coffee or breakfast if possible. Then take another reading in the evening. Take 2 readings about 1 minute apart. Record the results. Repeat this process for several days. Instead of looking at one stressful moment, you begin to see your real average. That average gives you and your doctor much better information. It can show whether your pressure is consistently high or whether certain situations are causing temporary increases. Another common reason people receive confusing readings is something called white coat hypertension. This happens when blood pressure rises in a medical setting because of stress or anxiety. Some people feel completely calm mentally, but their body still reacts automatically. The heart beats faster, blood vessels tighten, blood pressure rises. Then, they go home, and their numbers return closer to normal. This is why comparing home readings with office readings can be helpful. The goal is not to ignore high readings. The goal is to understand where they come from. Now imagine you check your blood pressure and see a high number. Should you panic? Not always. A high number by itself does not automatically mean you are having an emergency. A temporary increase can happen because of stress, pain, exercise, caffeine, or fear. The important question is whether symptoms are present. A high reading combined with warning signs is a different situation. If blood pressure is extremely high and you experience chest pain, severe, sudden headache, trouble breathing, confusion, vision changes, or weakness on one side of your body, that requires urgent medical attention. Those symptoms may indicate that high pressure is affecting important organs. But if your reading is high and you feel completely normal, the next step is often to sit down, rest, and repeat the measurement correctly. Many times, the number may come down after your body relaxes. Understanding this difference can prevent 2 opposite mistakes. The first mistake is ignoring dangerous symptoms. The second mistake is panicking over every temporary spike. The goal is awareness, not fear. Your blood pressure numbers are information. They are signals from your body. When you understand what those signals mean, you can make better decisions and have better conversations with your healthcare provider. Now that you understand how blood pressure should be measured, let's talk about what you can actually do with that information. A blood pressure reading is not just a number on a screen. It is a signal about how your heart, arteries, and entire circulation system are working. The biggest mistake people make is treating blood pressure as a simple problem with a simple answer. They think, my number is high, so I need more medicine. Or, my number is normal, so everything is fine. Both assumptions can be wrong. Your blood pressure needs to be understood in context. Your age matters. Your overall health matters. Your medications matter. Your risk of falling matters. Your activity level matters. 2 people can have the same blood pressure reading and need completely different approaches. For example, a healthy 65-year-old who exercises regularly may tolerate a different target compared with someone in their 80s who has balance problems, kidney disease, or a history of dizziness. This is why blood pressure treatment should always be personalized. The purpose of medication is not simply to lower a number. The purpose is to reduce the risk of stroke, heart attack, kidney problems, and other complications while keeping you strong and stable. One thing many older adults do not realize is that blood pressure naturally changes throughout the day. It rises when you exercise. It rises when you feel stress. It rises when you are in pain. It can rise after drinking caffeine. It can fall when you rest. Your body is constantly adjusting. That means a single reading does not tell the entire story. Think of it like checking the weather 1 minute after a storm begins and assuming you know the entire season. A single moment is only one piece of information. Patterns are what matter. This is why keeping a blood pressure record can be so helpful. Write down your readings. Notice the time of day. Notice how you feel. Were you stressed? Did you sleep poorly? Did you drink coffee before checking? Did you feel dizzy? These details give your doctor a much clearer picture. Another important factor is lifestyle. Blood pressure is influenced by many daily habits. Movement helps keep blood vessels healthier. Regular walking, strength exercises, and staying active can support circulation and overall heart health. Food choices matter too. A diet high in processed foods and sodium can contribute to higher blood pressure in many people. Foods rich in potassium, such as vegetables, beans, fruits, and other whole foods, can support a healthier balance. Sleep is another important part. Poor sleep can affect hormones that regulate blood pressure. Chronic stress can also keep your body in a more activated state, which may increase pressure over time. These lifestyle factors do not replace medication when medication is needed. They work alongside medical care. One of the most important conversations to have with your doctor is not just, "What is my blood pressure number?" Ask, "What is my ideal target based on my health? What symptoms should I watch for? Could my medications be lowering my pressure too much? Do my home readings match my office readings?" These questions help you become an active part of your healthcare. Many people over 60 feel like blood pressure decisions happen to them instead of with them. They receive a number, they receive a prescription, they leave confused. But understanding your own numbers gives you the ability to have better conversations. You can notice patterns, you can ask better questions, you can recognize when something feels different, because sometimes the danger is not that blood pressure is too high. Sometimes the danger is that treatment lowers it too far. Dizziness when standing, repeated falls, weakness, or feeling unusually tired can sometimes be signs that your blood pressure is dropping lower than your body handles well. Never stop medication on your own, but never ignore these symptoms either. Your doctor needs to know how you feel, not only what the machine says. The goal is not a perfect number. The goal is a healthy life, a number that allows you to move safely, think clearly, stay independent, and protect your heart. And there is one final piece that brings everything together. You now know the numbers. You know the mistakes. You know how to measure correctly. But you also need to know the difference between a temporary spike and a true emergency, because that difference can change how you respond when you see a scary reading on your monitor. Let's talk about one of the most common fears people have. They check their blood pressure and suddenly see a very high number. The first thought is usually panic. Am I having a stroke? Do I need to go to the emergency room? Sometimes that reaction is correct, but sometimes the number is temporary and caused by stress, pain, or anxiety. The important thing is knowing the difference. A high blood pressure reading without symptoms is different from a high reading with symptoms. For example, you check your blood pressure and see 170/95. That number is higher than it should be. But if you feel completely normal, without chest pain, severe headache, confusion, vision problems, or breathing difficulty, it may not be an emergency at that exact moment. The first step is to sit down, relax, rest for about 5 minutes, then check again using the correct technique. Many temporary spikes come down once your body returns to a calmer state. But there are situations where you should act immediately. If your blood pressure is extremely high, especially around 180/120 or higher, and you experience warning symptoms, seek emergency help. These warning signs include sudden severe headache, unlike anything you have experienced before, chest pain or pressure, new or worsening shortness of breath, vision changes, confusion, difficulty speaking, weakness or numbness on one side of the body. These symptoms may indicate that high blood pressure is affecting important organs. In those situations, waiting is not the right choice. Time matters, but without symptoms, the situation may be different. This is where many people become confused. They either ignore dangerous signs or panic over every high reading. Both reactions can create problems. The goal is not fear. The goal is understanding. Imagine someone checks their blood pressure right after an argument. Their heart is racing. Their body is filled with stress hormones. The reading may be much higher than their normal level. That does not mean their average blood pressure is suddenly dangerous. It means their body reacted to a stressful moment. This is why doctors focus on patterns. One high reading is a piece of information. Repeated high readings over days and weeks tell a different story. A reliable home blood pressure routine can help separate temporary changes from ongoing problems. Take readings at consistent times. Write them down. Look at the average. Do not let one number control your emotions. Your blood pressure machine is a tool. It is not a judge. It gives information. You decide what to do with that information by looking at the bigger picture. Now let's bring everything together. After 60, understanding blood pressure means looking beyond the basic question, is my number high? You need to understand, how high is it? How often is it high? What is my pulse pressure? How do I feel? Am I at risk of falls? Are my medications helping or creating problems? These questions create a much clearer picture. Remember the main points. Your blood pressure has two numbers. The top number, systolic, shows pressure when your heart beats. The bottom number, diastolic, shows pressure between beats. After 60, systolic pressure often becomes more important because arteries become stiffer with age. But a very low diastolic number can also create problems. Do not ignore the bottom number. Also remember pulse pressure. Subtract the bottom number from the top number. A wider gap may suggest increased artery stiffness. It is another piece of information that helps you understand your cardiovascular health. Measurement matters too. Rest before checking. Keep your feet flat. Support your back. Keep your arm at heart level. Do not talk during the reading. Take multiple readings instead of trusting one number. Small mistakes can create large differences. And finally, know the difference between a spike and an emergency. A temporary increase may come from stress or activity. A very high reading combined with serious symptoms requires immediate attention. Knowledge removes unnecessary fear. It also helps you act when action is needed. And that is the real purpose of understanding blood pressure. Not to make you constantly worry about numbers, but to help you protect your health with confidence. Your blood pressure is not a mystery. It is not just one number. It is a conversation between your heart, your blood vessels, your lifestyle, and your overall health. After 60, the goal is not simply to force the lowest possible reading. The goal is balance, a blood pressure level that protects your heart while allowing you to stay active, steady, and independent. You now understand that the top number and bottom number each tell a different part of the story. You know that systolic pressure often rises as arteries become stiffer with age. You know that diastolic pressure can sometimes become too low and create problems. You know that pulse pressure can provide another clue about artery stiffness. You know that one reading does not define your health. Patterns matter more than moments. You also know how important proper measurement is. Before checking, sit quietly for 5 minutes. Keep your feet flat on the floor. Support your back. Keep your arm at heart level. Avoid talking. Take more than one reading. Track your results over several days. This gives you a much clearer picture than a rushed measurement taken after walking into a clinic. You also know that lifestyle plays a role. Stay active. Walk when you can. Eat a balanced diet. Pay attention to sodium intake. Get quality sleep. Manage stress. Take your medications exactly as prescribed. And communicate with your healthcare provider when something changes. Your body gives you signals: dizziness, weakness, falls, unusual tiredness, changes in how you feel. These signals matter. A machine can show a number, but it cannot tell your entire story. That is why your experience matters just as much as your reading. Many people spend years afraid of blood pressure because nobody explained it clearly. They fear every high number. They ignore every low number. They make decisions based on confusion. But understanding your blood pressure changes that. When you understand your numbers, you can ask better questions. You can recognize problems earlier. You can avoid unnecessary fear. And you can work with your doctor instead of simply receiving instructions without understanding why. Your heart has supported you through every year of your life, every step, every challenge, every memory. Taking care of it does not require perfection. It requires awareness. Small daily choices add up. A short walk, a healthier meal, a correctly measured blood pressure reading, a conversation with your doctor. These simple actions help you stay involved in your own health. Remember this: blood pressure is a signal, it is not a sentence. A number on a screen does not decide your future. What matters is how you understand it, respond to it, and care for the body behind that number. If this video helped you understand your blood pressure better, subscribe to the channel, like this video, and share it with someone over 60 who may be confused about their numbers. Leave a comment sharing your current blood pressure reading and whether you have ever calculated your pulse pressure. Your experience may help someone else learn something important. Take care of your heart, because your heart supports everything else you do. This video is for educational purposes only and does not replace medical advice. Always consult your healthcare provider before making changes to medications or health routines.